Hello all and welcome back to the fourth episode out of my 4-episode vitamin D mini-series, and in today's episode I'm going to be exploring vitamin D and its health effects. If you can hear a dog crying in the background, I can only apologise. So this doesn't go to say that I won't be doing another episode on vitamin D in the future, but it just wraps up our 4-episode mini-series on vitamin D. So some future episodes may be more in-depth. This will certainly be the most in-depth out of the 4 episodes that I have done. So in this episode, I am going to be covering several topics on vitamin D. The first being cancer, the second being diabetes and metabolic conditions, the third being dementia and neuroinflammation, and the fourth basically being inflammation, immune system, aging and longevity. So I would like to start off with vitamin D and cancer. Now, we're going to be looking at a meta-analysis which pulled data from 10 randomised controlled trials, and this included 6,500 cancer cases. Now, the vitamin D supplementation did not reduce cancer incidence, so new cases of cancer coming about. However, there was a 13% reduction in mortality in those who supplemented with vitamin D and received cancer treatment. So this suggests that vitamin D improves survival in people who develop cancer, but not necessarily prevents cancer from occurring. Now I would like to discuss a study which involved prostate cancer and vitamin D supplementation. So it was a dose response, so meaning the higher the vitamin D, the lower the mortality rates, and every increase of 20 nanomoles per litre, the risk of death then decreased by 9%, which in prostate cancer is a lot. The authors of this paper proposed 3 main mechanisms where they think vitamin D was interacting with the cancer cells. The first being that vitamin D could cause cell cycle arrest, so out-of-control mitosis in cancer cells is arrested. The second was induced apoptosis, so cells that know that they've gone wrong will spontaneously commit suicide. That's what apoptosis is in cell biology. So the lysosome inside the cell is released and the cell self-digests essentially. The third mechanism was proposed that increased adequate levels of vitamin D protects the prostate's epithelial cells from oxidative stress. So I would like to discuss the expert insights of Professor Angus Dalgleish. Now, he's one of the top oncologists and cancer biologists in the UK. And these are his anecdotal findings as a clinician. This is not evidence based off randomized controlled trials or big data or anything like that. This is just his anecdotal findings as a clinician. So he's found that many cancer patients, especially interestingly melanoma patients, which is a type of skin cancer, have low vitamin D levels. Testing and supplementation may improve prognosis and therapy outcomes when combined with traditional therapies such as chemotherapy, radiotherapy and immunotherapy. Higher vitamin D levels will link to lower recurrence risk and enhanced immune function, which makes sense, and we'll be discussing vitamin D and immune function later on in the video. And he emphasises correcting deficiencies. I would just like to stress that broader randomised controlled trials confirmation still is needed for his claims, but it's interesting as a clinician what he's been seeing in cancer patients. So the takeaway essentially is that adequate levels of vitamin D may support better outcomes in people with cancer, and expert clinicians like Dalgleish advocate testing and correcting deficiencies, which could further improve survival rates and therapy responses. So I would just like to discuss a further 2 studies. The first one is to do with colorectal cancer, so colon cancer, which is a really, really big killer, particularly in the UK and the US. So there was pooled data from randomized controlled trials involving colorectal cancer patients. The findings showed a 30% reduction in adverse survival outcomes overall, including a 24% reduction in colorectal cancer-specific deaths, 33% reduction in disease progression or death. Now, this is quite an interesting finding. So beneficial effects are consistent across both targeted controlled trials and broader population trials. So the last study I would like to look at involves lung cancer and vitamin D. The overall sort of results of the trial weren't overwhelming. However, in an insight in the subgroup showed a 5-year overall survival improvement of 92% compared to 56%. The 92% survival rate was when vitamin D levels were adequate, and the 25% survival rate were when vitamin D levels were not adequate. So there's a really big difference in survival rates there. So moving on, I would like to discuss vitamin D and metabolic health, so looking at diabetes, and I would like to start off with prevention of type 2 diabetes. So in people with pre-diabetes, vitamin D supplementation has been associated with a reduction of risk of developing type 2 diabetes by around 10 to 13%. So that's quite good. That's quite a high percentage for prevention of diabetes type 2. And the benefits are interestingly strongest in non-obese individuals, as well as those with a vitamin D deficiency, which makes sense because you're correcting the deficiency. However, something I forgot to mention in one of the episodes that I previously did was people that are also at risk of vitamin D deficiency happen to be people that are overweight or obese, and this is because vitamin D is a fat-soluble vitamin, and in order for it to circulate within the bloodstream, it can't. If you have too many fat cells, you prevent it from circulating within the bloodstream. So it's really, really important to make sure that you're at a healthy weight, or if you are obese or overweight and you are taking vitamin D, to be tested regularly to make sure that your levels are where they need to be sufficient. Now, the impact of vitamin D supplementation in type 2 diabetes, so people that already have type 2 diabetes, vitamin D shows limited effects on blood sugar control overall. Some improvements are seen in those with poorly controlled diabetes, so fasting glucose reduction. Higher vitamin D levels are linked to a lower risk of metabolic syndrome, 16% lower risk per 10 nanomoles per litre. There are three main proposed mechanisms as to how vitamin D may impact type 2 diabetes. The first being that it supports insulin production in the pancreas, the second being that it may improve insulin sensitivity in tissues, and the third that it helps regulate inflammation and immune pathways tied tightly to metabolic health. Moving on, dare I say that I'm going to be turning up the heat a little on the scientific side of things. Just follow along, and at the end of the section I will have a takeaway, so perhaps if you aren't so sciencey that might help just to look at the takeaway, but I'm going to try and break down as much of the science as I can, as simply as I can. So the brain contains vitamin D receptors in various cells, and these include basically the brain's immune cells. These are astrocytes, microglia, neurons, and things of that sort. And this presence supports the neuroprotective effects of vitamin D. Okay, so these immune cells within the brain have vitamin D receptors and require vitamin D in order to fully function. Vitamin D receptors mediate vitamin D's action across the brain development, function, and neuroprotection, and they influence processes like neurotransmitter production and the clearance of disease-related proteins such as amyloid plaques. Now, interestingly, deficiency in vitamin D actually doubles risk of dementia. So people with very low vitamin D have up to 2 times higher risk of developing dementia or Alzheimer's disease. However, there are also protective effects of higher levels of vitamin D. So observational studies have shown that the higher vitamin D levels are linked to lower risk of cognitive decline and healthier brain aging. While randomized controlled trials results are mixed, large populational studies suggest that vitamin D supplementation may help prevent dementia, and especially in women as well as people who are deficient. So the takeaway is that maintaining adequate vitamin D levels may protect the brain and reduce dementia risk. The strongest evidence of this is in people who are deficient. Supplementation looks promising, but we do need some more large clinical randomized controlled trials to support and confirm all of these claims. So this ties in nicely with respect to vitamin D, neuroinflammation, and brain health. So vitamin D does modulate brain inflammation and neuroprotection. So vitamin D acts on vitamin D receptors in glial cells, microglia, astrocytes, to regulate pro-inflammatory cytokines and antioxidants, potentially protecting against neuronal damage. So when it comes to the brain, we don't want inflammation in the brain. So this is upregulation of something which we call cytokines. Say when you get a cold and you have a runny nose or a sore throat or a cough, that's as a result of cytokines. So it's inflammation making you show symptoms, essentially. So we don't want any of that in the brain. Any sort of cytokines or inflammation in the brain can look like things like anxiety, depression, and various other mental disorders. This could be as a result of viral infection, other forms of inflammation, and even mold toxicity. There are several mechanisms of action. So the first being that it enhances neuronal calcium uptake, which is essential for neurons. It boosts phagocytic function, so the ability of your immune cells to go after pathogens, and suppresses nitric oxide synthesis expression and supports astrocyte health. So this really highlights its anti-inflammatory and neuroprotective roles in the central nervous system and the brain. Now, there was an animal model regarding Parkinson's disease. So in rats, pre or post-treatment with vitamin D3, this reversed behavioural deficit, reduced oxidative stress, and preserved dopaminergic neurons, so neurons that produce dopamine, which is a neurotransmitter, and lowered tumoric factor alpha in the brain, which is a very, very pesky cytokine. So moving on to vitamin D, the immune system and inflammation. So we've just briefly touched on some immunology and inflammation in the previous topic of brain health, but now I want to directly address vitamin D and immune system function. Now, you may all have heard that vitamin D is the immune system vitamin, and that is quite right, yes. So vitamin D supports overall cell immune function. So there are immune cells such as monocytes, T cells, macrophages, and they express vitamin D receptors and vitamin D activating enzymes. This indicates that vitamin D is central to immune regulation, including in inflammatory and autoimmune diseases. So this could include lupus, rheumatoid arthritis, multiple sclerosis, etc. Vitamin D also has anti-inflammation and gene regulation effects. So vitamin D supplementation influences immune-related gene expression and pathways at the nutrigenetics and nutrigenomics level, although human-level clinical data remains limited. Interestingly, now I've actually experienced this myself, since supplementing with vitamin D. Vitamin D actually reduces asthma exacerbations. So meta-analysis of randomized controlled trials showed that vitamin D supplementation showed that 36% lower risk of asthma exacerbations requiring oral steroids and 61% lower risk of severe attacks needing emergency and hospital care. There have also been interesting results on respiratory infections involving vitamin D. So a meta-analysis suggested that there was moderate protection against colds and flus, especially in vitamin D deficient individuals. So when they were given vitamin D, there was a modest protection and reduction in colds and flus. There also seems to be very good benefit for vitamin D and autoimmune conditions, again, like we've said, sort of MS, lupus, rheumatoid arthritis, etc. So in a randomized controlled trial of 303 patients with early signs of multiple sclerosis, high-dose vitamin D, now they were given 100,000 international units weekly of vitamin D, reduced relapse. And this was seen in MRI activity from 74.1% to 60.3%. So there was basically a 14% reduction in relapse. So finally, let's discuss vitamin D and aging and longevity. So vitamin D does slow biological aging. So in a telomere, so telomeres are essentially the caps on the end of of your chromosomes. The longer telomeres are, it's thought that the more longevity you have. Shorter telomeres are associated with mortality. So in a telomere sub-study of randomized controlled trials, adults who were over 50 taking 2,000 international units of vitamin D for 4 years had significantly less telomere shortening. So this was roughly 3 years worth of aging prevented. A Harvard-linked analysis also confirmed that vitamin D supplementation may preserve DNA integrity and reduce inflammation. So these are both tied to aging and longevity. You may also hear the term inflammaging. Okay? High levels of inflammation are associated with rapid aging and reduced longevity. Lower mortality has also been associated with higher vitamin D levels. A 14-year Korean cohort involving 9,000 participants showed that those with blood levels of over 25 nanomoles per litre had 31% lower all-cause mortality, with a plateau at 50 to 60 nanomoles per litre. Cancer mortality dropped even more in this study, which was also very interesting, linking into the first part of this video. There was also another study conducted by UK Biobank where 365,000 participants, this is quite a large-scale study, Vitamin D levels of 60 nanomole per litre or higher were linked to 17% lower all-cause mortality, 23% lower cardiovascular mortality, and an 11% lower cancer mortality. So, to wrap up our vitamin D mini-series, please make sure that you're getting your vitamin D levels tested. Just ask your GP, it's a very simple blood test, make sure that you're getting adequate levels of vitamin D, and that you're also, if you're taking a vitamin D supplement, taking it with vitamin K2, as well as magnesium. I have no affiliation with this company, but there is a company that I use called Youth and Earth that have 4,000 international units of vitamin D, as well as 200 micrograms of vitamin K2 in one pill. You would have to source the magnesium from another supplement entirely. Overall, vitamin D has potential anti-aging and longevity effects. It significantly reduces inflammation, which in turn helps decrease adverse health events such as cancer mortality and risk of dementia, type 2 diabetes, etc., as we've all covered in this video. I hope that you've enjoyed this video, and in the next video we're going to be covering the topic of magnesium and everything about it. So please stick around for that video. Thank you very much for watching, and I hope you found that interesting. And remember, that was Science Made Simple.